be so for a while. However, we have observed, after going through our data, including the data that we will share with you today on mortalities, that we are witnessing majority of the deaths in patients who have underlying issues such as diabetes, hypertension, and HIV/AIDS, amongst others. And we want to address the issue of HIV/AIDS today and its correlation to COVID-19. In Kenya today, out of all the HIV positive people who have been confirmed to be positive, 96% of them are on life-saving treatment. And more than 90% of those on treatment have controlled the HIV virus, therefore posing very low risk of transmission for HIV. We have further evidence that there is a decrease in the new HIV infections in the country to a mark of about 36,000 in 2018, which is really a stark reduction from our 2012 figures that stood at 100,000. And this is notable and remarkable. And indeed, Kenya is on its way when it comes to achieving epidemic control. And currently, in Kenya, we have 1.1 million people who are benefiting from antiretroviral treatment. Again, a remarkable achievement and a testimony to the strength and the resilience of our HIV program. And this progress can be attributed to many factors, amongst them, primarily, an excellent partnership with bilateral and multilateral agencies, the use of a multisectoral response, and a strong health sector leadership and strong political commitment, all of which have contributed to this success. However, as we celebrate this success, we need to be aware that COVID-19 poses a challenge to the uptake of HIV testing services, particularly due to the low outpatient hospital visits during this period. Yesterday, we articulated that we've seen a drop in outpatient visits by about 30%. And what this means is that majority of our people are no longer visiting health facilities for HIV testing services, and therefore there's a decline in knowing the true status when it comes to HIV. The lowest uptake was particularly noted in the month of March and April, where we had testing volumes reduced by up to 33%. On the other hand, we also note that community testing has also reduced by 71% when it comes to HIV care. We have noted that HIV pregnant mothers do continue to attend their ANC clinics, and there's been a slight impact of COVID-19 to this statistic. And so it becomes important really today to focus on this condition, noting the gains made in the country, but emphasizing that we do need to pay attention to ensure that we don't lose on the results that we've gained. Ladies and gentlemen, we have an upward trend in the number of clients newly enrolled in antiretroviral therapy between January to July. However, even as we enroll these clients, again, due to COVID, there is a problem when it comes to these clients being able to get their ARV treatment. And we've seen a decline, again, when it comes to refills for these medications. From available data, the 90-90-90 targets indicate that 83% of HIV-positive clients have been identified, 87% of whom are enrolled in care, and 93% of those who are enrolled have achieved viral load suppression. And perhaps to define this further, 90-90-90 is a global strategy, one that Kenya has signed on to, and you can see how we are performing when it comes to the three measures of the 90-90-90. Right now, we have 83% of HIV-positive clients being identified. We do fear that COVID-19 may actually reduce this percentage. Of those that we identify, we have 87% enrolled in care. And again, a concern here, because being enrolled in care means that you're attending your clinics and you're getting your prescriptions. And again, with COVID-19, this is bound to be affected. And then, of course, 93% of those who are enrolled achieve viral load suppression. And how you achieve viral load suppression is by taking your medications. And because of COVID-19 and reduced OPD visits, we are fearful that again these indicators that we've achieved may actually go down. So even with the emergence of COVID-19, as government, we continue to put in place resources to ensure that lab testing for HIV is available. Taking note that as we test for COVID-19, the very same test that is the gold standard of COVID-19, that is the PCR test, is also the very same test that we utilize when checking for HIV viral loads. And so what we've done, we've been able to look at our mechanisms and our framework, our logistic framework, to ensure that HIV testing continues on and that we're able to provide these two services when it comes to testing. With regard to our COVID-19 situation, today we have 667 positive cases out of a sample of 5,075 in the last 24 hours. And this brings to total the number of positive cases in the country to 16,268. And our cumulative cases stand at 266,102. From the cases, 657 are Kenyans, whereas 10 are foreigners. 393 are male and 274 are female. And the youngest one is a 1-month-old infant, while the oldest is 92. And in terms of distribution by county, we have Nairobi leading at 387, Kiambu at 40, Mombasa at 26, Machakos 47, Kajiado 79, Nakuru 15, Uasin Gishu 14, Garissa 11, Busia 9, Kilifi 6, Turkana 6, Makueni 5, Wajir 5, Kisumu, Nyeri, and Lamu having 4 cases, Murang'a 2, and Bomet, Bungoma, Narok, Nyamira, and Vihiga having 1 case each. And again, we've provided a distribution when it comes to sub-county disaggregation. And for Nairobi, again, today, we have Dagoretti North leading. Yesterday it was Kibera. Today Kibera is second at 32. We have Westlands having 32 cases, and Embakasi East having 30. And the situation continues in each of the counties, with the hotspots leading in terms of numbers. Again, to mention a few, in Machakos, Athi River remains as the lead with 41 cases. In terms of Kiambu County, we have Kikuyu having 13. We have Kiambu having 6. We have cases in Gatundu South, Kiamba, Lari, and Ruiru having 4 cases. And in Mombasa, Mvita again leading with 13 cases, and Jomvu having 9. And we've provided for you the disaggregation by each county, by each sub-county, with the highest county to the least county. On a positive note, 311 patients have recovered from the disease, and out of this, we've had 166 from the home-based care program, while 145 from various hospitals. And this brings the total number of recoveries in the country to 7,446. And we continue to thank our healthcare workers for this achievement. Unfortunately, we've lost 11 patients from this disease, bringing our fatality to 274. And what was striking for me today as we reviewed this mortality data is that we've actually lost a child due to rickets. And I found it necessary to really highlight this today because even as we impose physical distancing, even as we say stay at home, then it means that if our children are staying at home, particularly those who live in apartments or areas where there are no fields, then it means that there's a risk when it comes to rickets. And how to take care of rickets is to ensure that your child has access to vitamin D, which is best sourced from the sun, and a healthy diet. And so the fact that for the first time we've actually had a fatality and that this child had rickets really is a cause for concern. It means that we need to relook to see as parents, even as we have our children in the houses, how can we ensure that there is an element of sun exposure and, of course, healthy diets. We continue to pass our sincere condolences to the families and friends of those who have lost loved ones during this pandemic. And finally, we would like to reiterate that our health facilities countrywide continue to be operational for treatment of all other diseases not just COVID-19. And therefore, we appeal to people not to shy away from utilizing services, and this includes the HIV testing services that we've discussed today. We have seen a decline in terms of service utilization, and we do continue to remind you Kenyans that if you are unwell, you should go and seek care at the health facility. Our healthcare workers remain ready and willing to attend to all ailments and not just coronavirus. So let us make use of these facilities. Thank you.
Dr. Ali, my name is Elfas Legat from Citizen Television, and my question is on the increase of caseload, especially the last 3 weeks have particularly been revealing in terms of numbers of positive cases. Where are these numbers from? Are they targeted mass testing, or is it contact tracing? And again, we understand that there are government institutions that have ordered their staff to be tested. If you can kindly give us a breakdown of the same. And also in terms of facilities, hospital facilities, with the numbers, you've mentioned before that in the coming weeks, the numbers will peak. How are our capacity in terms of hospitals to handle these rising numbers? And also, Daktari, there is the aspect of stigma regarding the people who turn out positive, and reluctance, particularly from officials from government, to reveal their status. Have you deliberated on this new emerging trend of stigma for particularly patients who have turned out positive? Thank you.
Thank you, Mark Namasa from KTN News. My first question is, I've received a call from a female patient at the Kenyatta University Referral Hospital, a COVID-19 patient. She says she was admitted together with her 3 children, so there are 4 family members there. Then, about a month ago, and then yesterday, one of the children tested negative and wanted to be cleared to go home. The child was told to pay some 90,000 shillings. So when she does her mathematics for 4 family members, if they all turn negative, then the hospital wants close to 400,000 shillings from her. So my question is, when did government decide that people who have been admitted in government facilities will now have to foot their own bills? They claim it is accommodation fee at the rate of 3,100 per day. My second question concerns people who drop down dead. When does government decide that these are COVID-19 cases? Does government go to the step of testing these people who die mysteriously and confirm it is a positive COVID-19 case? Thank you.
My name is Eunice Omolo from NTV. I have 2 questions. The first one, how many people actually need hospitalization in the country in regards to COVID-19, or rather how many people have been hospitalized? Then my second question is in regard to the NMS. They have a plan to set up 24 hospitals in 4 slums in Nairobi in partnership with the Ministry of Health. How much has been set aside for that, and how soon is the project intended to start? Thank you.
I think I can see one more hand from Purity, who is Zalendo, so go ahead.
Thank you. Good afternoon. I have concerns, a follow-up on the HIV status. You said that 96% of people living with HIV who are COVID positive are under some sort of support, life support. Would you break the numbers for us? How many have tested positive, and maybe how many have succumbed to this disease? And then the other concern is you've occasionally talked about the surge or the peak, the projected peak to be around early August or even up to September. What is the level of preparedness in terms of capacity, in bed capacity, and even in counties? Lastly, you've also been talking about utilizing the community health workers. Most of the times, these healthcare providers do some sort of charity work with no pay, volunteering. So is there a budget for them, or how are you planning to make use of them?
Thank you. Thank you all for your questions. I think I'll start with Elfas's question from Citizen, where he has asked, where do we get our numbers from? And I think this is a question that has arisen during past several briefings. And related to this is then the question of, are we testing any government institutions? And if we are, which ones are we testing, and can we release those results? What I'd say is that in terms of our testing strategy, we've often, informed you that in national government, the testing emanates from what is known as our Emergency Operations Center. Our Emergency Operations Center is situated at Afya Annex, and I'd really invite you, members of the Fourth Estate, to perhaps also feature that center because that is the nerve bit of this COVID-19 response. And in that center, we have what we call rapid response teams, and that is where these rapid response teams are dispatched from. So when we get an alert either here in Nairobi or an alert in the counties, that alert is transmitted through the 719 number to the Emergency Operations Center, and their teams are dispatched to be able to either go collect the sample, if it is here in Nairobi, or to coordinate with county rapid response teams, of which all counties have been able to put together rapid response teams. And once these teams are alerted, they then, of course, go to the incident area. They're able to pick a swab, take the tests, and they're able to also initiate contact tracing. So that is how we get our numbers. One of the other ways in which we're able to get our positive cases is in cases where we are conducting targeted testing. For example, testing of healthcare workers, testing of other frontline workers, people in security, testing of different government institutions, most recently the courts. I'm sure you saw that story in the paper. So then we go in there and we conduct testing. Yes, there are various other government institutions that have undergone some form of targeted testing, especially when we have traced a contact to that area. And so this is an ongoing situation that's evolving. And in terms of releasing and sharing with the public, there are mechanisms. The contact tracing mechanism is one of the mechanisms in which immediately a case is identified or a cluster is identified, then the measures needed are put in place. With regard to capacity of our hospitals, and I really want to link this up with Purity's question on, we've talked about our numbers going up. Are we ready? Do we have capacity? Yes, as it stands, and Dr. Kuria will elaborate on this. When we look at our beds, I think Kuria did give a brief recently. We have about 12,000 beds across the country, and the number is still building. Every day, counties continue to increase the number of beds. When it comes to ICU care, perhaps an issue that has really been highlighted in media, an issue in which we've gotten numerous phone calls on. Yes, in Nairobi, there are days when our ICU beds have been full, but remember, across the country, we have about 400 ICU COVID beds that are available. And so in terms of our assessment, we are not yet overwhelmed. We're still under the threshold of raising the alert level. When it comes to stigma, we've spoken to this several times here in this press briefing as individuals. I think we've seen different people, share with you how the testing procedure is done to allay any fears when it comes to testing. And those who, and it is their personal right, and we must respect that personal right, when they do feel like they can then release their results, be they positive or negative. And really this is important, and you as a Fourth Estate can help us here. If you tested us here as government officials, I can bear you witness, beyond COVID-19, we have other conditions. I'm not sure if Dr. Kefa here wants to have his BP checked right now. Perhaps he's hypertensive. I am diabetic. He probably has another condition. So the idea of expecting that, officers or any individual, even yourselves, would release the results, really, it requires some better management in terms of respecting individual rights, but also realizing that by drumming all that up, it does also aid in creating the stigma. That being said, we continue to really put in place interventions dealing with, talking to the community. And I saw teams this morning sharing their pictures of what they're doing in the field. There are teams in Vihiga now, in Bungoma, talking to the residents, taking them through what it means to pass a swab through their nose, trying to allay that stigma. And we really do ask for your support when it comes to that fight of stigma. There's a question on the COVID-19 or the COVID-19 patient in KU. Thank you for bringing that up. I think I got a report of this case about 3-4 days ago, and we maintain that COVID-19 treatment in public facilities is being handled by those public facilities, and there are no costs attributable to that. And this is a case that we've actually managed, and we are managing to follow through. There are no costs, and the Cabinet Secretary has announced this several times. There are no costs at public facilities when it comes to treatment. And remember, this, again, is another element of stigma, and we had to remove this, cost implication so that people can feel free and ready to receive care when they need it. There is a question of what happens, and this was quite interesting. People are dropping dead, and this has been happening, and I don't want to be morbid, but people have been passing away even before COVID-19. We've received a few cases, in fact, as early as this morning, of someone who passed on in a banking hall. And the thing is, we don't want to create fear and panic in the country. Not every person who is unwell has COVID-19. And when people do present to us and there's suspicions, a history has been taken, or perhaps the death is deemed to be of suspicious circumstance, of course, due diligence is done and tests are done. And we've repeatedly announced in some, past press briefings that we've actually identified COVID-19 patients posthumously after they've passed on. We've been able to take the sample and identify that that was COVID-19 patient or positive case. And so really the idea and the panic that is spreading, that, people are dropping down, again, partner with us, the Fourth Estate, to really allay fears and to have Kenyans realize that other diseases are still around within the country. It's not just COVID-19. There is a question on how many people need hospitalization, and I think Dr. Kuria will assist in this, in terms of when we look at the pathophysiology or the pathway of this disease. Yesterday we told you about 80 to 89% of our patients are asymptomatic. So for those patients, we do feel they may not require hospitalization. And for them, management means isolating them. Then there's this other, percentage of patients, 5% or so, who may have more mild to moderate disease. These are patients who definitely need care, particularly because these patients can transition very quickly from mild to moderate disease to severe disease. And some of these patients are on just oxygen and basic painkillers. And then, of course, we have the critical 5%, who will always be very critical and require ICU care. And so when we look at our models, our tabulations, when we look at our current cases of identified positive cases, this picture maintains. This is actually the trends that we are seeing. And so between 5 to 10% are the ones we would need hospital beds for. Regarding a question on NMS setting up hospitals, what we'll do when they're ready, the NMS team will be able to share with you the budget outlays of the hospitals. What I can confirm is we do have about 20 plus hospitals that will be set up, focused in high density areas across the country. And this team really is doing exemplary work, and we continue to champion the work that they're doing. We feel that the setup of these hospitals will be a game changer for Nairobi. We will have level 2 hospitals, and we'll also have level 3 hospitals, and highly focused to providing essential services in these areas. And perhaps in the next press briefings, we might be able to come in with the NMS team and showcase the good work that they're doing. I think we have a question, and this is just to clarify in terms of the statement we've made today for HIV. What we mean is that 96% of all HIV patients in this country are on treatment as they should be, and that's a good thing. We have not said that they have COVID, and it's important to clarify that. What we are saying is that we are happy as a country, we are meeting the targets when it comes to our HIV approach. That every time you identify a positive case of HIV, you're able to ensure that this person is enrolled into a care program. And so we are doing well. However, we are raising caution that with COVID-19 and low-seeking health behavior from ourselves, this may hamper this achievement. And that's what the aim of our message is today, really, in terms of seeking care. We have a question on CHVs, community health volunteers, a very key asset for us, who are doing exemplary work in Nairobi, in different parts of the country, and we continue to really appreciate the work that they're doing. As we speak today, this strategy is highly supported by our development partners. We have UNICEF doing a fantastic job in training them, a fantastic job in monitoring and evaluating the work they do, a fantastic job even in providing kits for our community health volunteers as they move from house to house. We also have AMREF and Red Cross partnering on this initiative. What we do see as government is we're in the process of reviewing to see how we can then adopt these community health volunteers in a manner that is sustainable. And so perhaps in the coming few weeks, we'll be able to share this with you and to highlight that great progress has already been made, because just last week in Nakuru, the Cabinet Secretary was able to launch the community health policy. And in that document, we envision measures in terms of sustainability of these community health volunteers. At this point, I'll invite Dr. Kuria to add in terms of our preparedness and other questions.
Thank you, Waziri. I think we have highlighted this issue of availability of isolation facilities across the country. And you might well be aware that on Monday, His Excellency the President has asked for a summit again between the Cabinet Secretaries and all the governors. They're going to address again this issue of preparedness of the country and the counties in terms of the target that he gave them of 300 beds per county for isolation beds. So as we stand today, we still have the figures that we have. Well aware that there's a team from the Ministry of Health that is going around the counties, that's assisting the counties, assessing this capacity indeed, and assisting those that need to be technical assistance in setting up these isolation facilities. So the teams are set up in 11 clusters. They are out there assessing counties and assisting counties to set up more facilities as we prepare for more patients, as we are starting to see our patients going up. So we mentioned last week that we have at least, as of now, 12,000 beds, 12,513 beds, normal isolation beds, and about 498 ICU beds for COVID patients. If you look at our figures today, number of patients in hospital is about 1,179 across all the facilities. And the number of patients in ICU across the country is about 50. So as Waziri said, the capacity is still there. We may be feeling this effect that in Nairobi there are so many cases. Yes, you may have had this going around, but overall the capacity is still there. But we are making every arrangement to improve the capacity also in Nairobi, because this is where the majority of the cases are. And I think even as of this morning, there was a strong meeting with Waziri and NMS, and I think even the Ministry of Interior. We are trying to increase this capacity for Nairobi, because this is where most of the cases are. And we'll be advising the members of the for the state and the public indeed on how I am moving by the beginning of next week. There's a question that was raised about where we get our cases, Waziri, and indeed, yes, it is from our rapid response, and as someone mentioned, that we are having a few government offices asking for testing of their members. But we would want to urge members of the public and even the government offices, testing does not give you a sense, just gives you a sense of false assurance that you are safe. So much as you may want to clamor for that testing, it is still, and I will still insist, that it is the measures you take before or after that test that are going to matter. So this need for testing of whole buildings may not be very important here. And our strategy, testing strategy, still indicates that we test those who have symptoms and close contacts of those that have been identified as positive, not entire buildings. It has to make scientific sense when you ask for testing for a whole building. This building doesn't, if Waziri is a confirmed case, I have not been in contact with her today, so do I need to be tested when she... So we've got to have sense in when we ask for testing. There was a case on stigma and about the strategy, and I think this is where we have said again and again that I can get it, you can get it. And this idea of stratifying people, saying that these numbers from this building or from this strata of population has it, is not going to help us fight this pandemic. It is how you prepare yourself to fight the pandemic. And the preparedness is being ready to follow the guidelines that we have issued. And they are still simple, the rule of 3. Wear your mask properly at all times. We will not tire saying this, because this is what we need to propagate again and again. Wear your mask properly and at all times. Wash your hands and sanitize them as frequently as possible, and keep your social distance. If you only keep those three, testing will not be very necessary here. So keep your distance, wash your hands, and wear your mask properly. I think I'll end there, Waziri. Thank you.
And I think that's a good space to end. Follow those 3 rules. We have to end. Thank you. Tomorrow, another day.